I believe we can start now. Thank you.
Hello, everyone. I'm Binta Sako, and welcome to the WHO Africa Media Briefing. First, some housekeeping. We have interpretation available, and you can choose the language you would like to hear the conference by turning to the globe on the bottom right and selecting your language. Kai, please explain in French.
Merci Binta, bonjour et bienvenue à tous à la conférence de presse de l'OMS Afrique. Vous pouvez choisir de suivre cette conférence en français en cliquant sur le globe interprétation en bas à droite de votre écran et en choisissant donc la langue française. Merci et bonne conférence.
Thank you, Kai. Joining us from Brazzaville, Congo is Dr. Matshidiso Moeti, WHO Regional Director for Africa. I will now let Dr. Moeti introduce our other panelists. Over to you, Dr. Moeti.
Thank you very much. So I'd like to wish a very good morning, good afternoon, bonjour, and welcome to all the journalists joining this press conference today, where we'll discuss the heightened risk of zoonotic diseases like monkeypox being transmitted between animals and humans. We'll also spend some time on the latest trends in COVID-19 cases in the African region. Although coronaviruses are classified as zoonotic, no animal reservoir has yet been identified for the SARS-CoV-2. I'm very pleased to be joined today by the epidemiologist and infectious disease specialist, Dr. Franklin Asiedu-Bekwe, Ghana's Director of Public Health. Welcome, Dr. Asiedu-Bekwe. And Dr. Karim Tunkara, the regional representative for Africa of the World Organization for Animal Health, or OIE. Bonjour, Karim, it's been a while, and very warm welcome to both of you. More than 60% of human infectious diseases and more than 75% of emerging infectious diseases are caused by pathogens shared with animals or domestic animals, with wild or domestic animals. They account for a substantial burden of disease, resulting in about 1 billion sick people and millions of deaths globally every year. For Africa, the threat is severe. Indeed, new WHO analysis has revealed a 63% increase in the number of zoonotic outbreaks in the African region in the 10 years to 2022 compared to the previous decade. 1 in every 3 confirmed public health events in the region in the past decade was a zoonotic disease outbreak, with a significant spike in 2019 and 2020, when these diseases accounted for half of all public health events. A deeper dive reveals that Ebola and similar hemorrhagic fevers constitute nearly 70% of these outbreaks. The remainder include, among others, monkeypox, dengue fever, anthrax, and plague. Although there's been a notable increase in monkeypox cases since April this year, compared to the same period in 2021, the positive news is the numbers are still lower than for the 2020 outbreak peak, when the region recorded its highest ever monthly cases. Following a sudden drop in 2021, 203 confirmed cases of monkeypox have been recorded in the region since the beginning of the year. That means confirmed cases. Available case-specific data for 175 of these cases show that just over half the patients were men with an average age of 17 years. However, Africa cannot be allowed to become a hotspot for emerging infectious diseases. It's true that the infections originating in animals have been jumping to humans for centuries. But as rising urbanization encroaches on the natural habitats of the continent's wildlife, and a demand for food from an especially fast-growing population burgeons, the risk is heightened. The addition of improved road, rail, and air links, which remove the natural barrier that poor transportation infrastructure provided, opens the way for the spread of zoonotic disease outbreaks from remote to urban areas. The West Africa Ebola outbreak is evidence of the devastating number of cases and deaths that can result when zoonotic diseases arrive in our cities. We all have vivid recollections of that. Africa needs a multi-sectoral response, encompassing experts in human, animal, and environmental health, working in collaboration with communities. Equally crucial are reliable surveillance mechanisms and response capacities to rapidly detect pathogens and mount robust responses to quell any potential spread. Since 2008, WHO has strengthened its regional collaboration with the UN Food and Agriculture Organization, FAO, and the World Organization for Animal Health, OIE, to support efforts to address zoonotic outbreaks across the continent. Recently, the three agencies worked together in response to the 14th Ebola outbreak, which has just ended in the Democratic Republic of the Congo. It's exactly this all-hands-on-deck approach that's needed to counter the threat and give us the best possible chance of averting a new big health shock in Africa. Turning now to COVID-19, the number of new cases on the continent decreased marginally last week. However, the overall plateau continues to be sustained by increasing case numbers reported from North Africa for the 8th consecutive week. The surge is being driven primarily by the situation in Morocco and Tunisia, which spurred a 17% increase in new cases in North Africa compared to last week's statistics. Botswana, Namibia, and South Africa all reversed their recent surge in new cases in 4 to 6 weeks, thanks to significantly improved capacities for rapid detection and response to curb further spread. The same trend is expected in the North African countries, which have excellent detection and response capacities, and the curve is already beginning to trend downwards in Morocco. This potential for continuing surges highlights the fact that countries can't afford to ease up on efforts to vaccinate their populations against COVID-19, especially healthcare workers, the elderly, and those with comorbidities. These are the most vulnerable groups to severe illness and death. This phase of the pandemic may well be characterized by relatively low incidence and much lower risk for hospitalization and death, but the Omicron variant remains highly transmissible and the pandemic is far from over. Thank you all very much for joining us, and I look forward to what I'm sure will be very interesting discussions today. Thank you.
Thank you very much, Dr. Moeti, for this overview on the topics that will be discussed today. Now I'd like to turn to Dr. Karim Tounkara. Could you share some observations about what is being done to control pathogens in the animal kingdom?
Thank you. Thank you. Dr. Matshidiso Moeti, WHO Regional Director for Africa. Dr. Franklin Bikoe, Director of Public Health Ghana. The press, distinguished guests. I'm very pleased to convey to you the warm greetings from Dr. Monique Eloa, the Director General of the World Organization for Animal Health, OA, founded as the Office International des Épizooties, OIE, in 1924. Thank you for inviting us and for the opportunity to engage in these important topics. The mandate of our organization is to improve animal health globally, thereby ensuring a better future for all. We notably do that by disseminating information on animal health, on animal diseases, and using science-based strategies to limit their potentially negative impact on society. We monitor the emergence and development of animal diseases, whether they affect livestock, aquatic animals, or wildlife, to address them before they become a threat to public health. Today, it is estimated that 60% of pathogens that cause existing human infectious diseases originate from domestic animals or wildlife. We call them zoonoses. At least 75% of emerging human pathogens are of animal origin. These figures remind us that diseases ignore borders and species barriers. According to our World Animal Health Information System, WAHIS, the most reported zoonotic diseases in animals, as declared by our 54 African member states during the last 4 years, are rabies, anthrax, highly pathogenic avian influenza, and rabies, and Rift Valley fever. Rabies was the most reported diseases, with 44 countries reporting its presence at least once in domestic animals and 26 in wildlife. As you all know, there is a global strategic plan to end human deaths from dog-mediated rabies by 2030. Emerging diseases at the human-animal ecosystem interface are occurring with growing frequency in Africa. This is facilitated by various factors, such as the changes in land use, higher levels of intensive animal production, the expansion of croplands and urban sprawl. These factors, combined with others such as climate change, have heightened the encroachment of humans into natural habitats, displacing animals that had previously lived in isolation and reducing biodiversity. These disruptions to natural ecosystem increase the risk of diseases spillover between animals and humans. The occurrence of zoonotic diseases provides evidence that a long-standing and sustainable One Health collaboration is needed that calls for a holistic and system approach, recognizing the interconnection between the health of humans, animals, plants, and the environment. That's why all WOHA supports are provided within the framework of the One Health Global Tripartite Agreement, initially signed in 2010 between OIE, WHO, and FAO, and now quadripartite with the inclusion of UNEP as an equal partner, and the establishment of Africa Region One Health Tripartite, now quadripartite Secretariat in 2019. WOA set animal health and welfare standards to improve veterinary public health and secure the international trade of animals and their products. Moreover, it has set up several initiatives to strengthen the capacity of veterinary services, including veterinary laboratories, notably through its flagship program, the Performance of Veterinary Services, PVS pathway. We also have developed a wildlife health framework and implemented specific projects aiming at improving the animal diseases surveillance systems, such as Ebola and Redice. WOA is undertaking joint capacity building activities with WHO, such as the Joint External Evaluation Mission, Joint Risk Assessment, National Evaluation of Performance of Veterinary Services, and the International Health Regulation through National Bridging Workshop. WOA support the negotiation process for the development of a new international instrument on pandemic prevention, preparedness, and response. Let's not forget that animal health is our health. It is everyone's health. Together, we can find a concrete solution for a healthier and more sustainable world. I thank you.
Thank you very much, Dr. Tunkara. Dr. Franklin Asiedu-Bekwe, could you tell us about Ghana's experience with managing zoonotic diseases? Dr. Franklin Asiedu?
Thank you very much, and good morning. Good morning to the Regional Director, Dr. Moeti, and then Dr. Karim, and then all ladies and gentlemen on this panel. I'm speaking on behalf of our Director General. Ghana has been doing IDSR over the years, and I will say that we keep priority on over 40 disease conditions. Viral hemorrhagic diseases are not very common in Ghana. The common ones are actually yellow fever, which is commonly reported in the northern part of the country. 10 years ago, we reported a few cases of Lassa fever in the Middle Belt. And since that time, we have not reported any other cases of Lassa fever. This year and later part of last year, we reported an outbreak of yellow fever, which is across most of the regions in the country. So I would say that in terms of viral hemorrhagic fevers, the dominant one has been yellow fever. And I would say that the Ghana Health Service together with the wildlife and the veterinary services, have been working over the years. We have even gone ahead to develop a draft One Health policy that is yet to be finalized. Normally, One Health issues becomes very prominent when there's an outbreak, and then we try to make sure that the two systems work together. So for the year 2022, we have been keeping our surveillance on track until, let me say that the 27th of May, we had a report from the IHR focal point that there's a Ghanaian who has confirmed with monkeypox in the US. So that was the first incident of monkeypox in the country. Our records does not support any human case being reported, though there's a record of monkeypox in an animal. So we set out our surveillance system to actually investigate these monkeypox. After taking the samples to our reference lab, it came out as positive. So as I speak today, we have actually confirmed 30 monkeypox cases. And one thing which is good for us is that our main lab has been Noguchi, that's the Noguchi Memorial Institute of Medical Research. But as I speak, we have 2 additional labs that are also able to confirm monkeypox. So if you look at the data that we have 30 confirmed cases, but most of them are actually from Greater Accra, the capital. And then there are a few other regions in the middle part of the country. What we've done is that we actually sent alerts to all the regions and districts of the country. We actually sensitized clinicians. We took advantage of the COVID-19 to orient and train clinicians about how to manage monkeypox, viral hemorrhagic fevers, and that has been ongoing. I would say that for all the 30 cases that we have gotten in Ghana, they have all been mild cases. There's no clear established sexual linkage with the cases. And the youngest age is 9 months. This was an infant that had the siblings presenting with rashes, and the mother was not sure what it was until he reported, and that was confirmed as a case. So the oldest case is just over 50 years, but dominantly the cases that we have in Ghana are all males. Then come to about 2 weeks ago, there was a district in the middle part of Ghana that actually reported of suspected acute hemorrhagic fevers. So there were 2 cases that actually died. They are presented with a local hospital with symptoms of fever, general bodily pains, diarrhea, bloody stools. So the first case actually was not suspected. If you look at the diagnosis from the clinician, they actually suspected upper GI bleeding and even rule out acute gastroenteritis. But then 2 days after, another case reported in the same hospital, and that had presented with also bleeding, abdominal pains, and had died. So you have 2 cases all dying within a matter of 48 hours. And that raised the suspicion of could it be acute hemorrhagic fevers. So samples were taken and sent to our reference lab. That gave us initial diagnosis of Marburg. So as I speak, we have 30 cases of monkeypox, 2 cases of Marburg. What we tried to do was that we actually took samples, or the samples that we had from Noguchi have actually been sent to Institut Pasteur, because we think that WHO reference lab for hemorrhagic fevers is Institut Pasteur. So it's been sent to there. We had a meeting with all the partners, and then we also had an EOC meeting purposely to look at what is happening. So for the 2 cases, we have actually identified 63 contacts. Of the 63 contacts, only 1 has shown any sign and symptom. So he had a fever and had bleeding in the stools. Samples were sent to the Noguchi, which has come out as negative. So we have, today is the 18th of majority of the contacts, and they are all asymptomatic. So what we continue to do is, based on the investigation that were done by the country team, we try to expand our detailed investigation, because so far we'll not be able to establish any source of the infection. But I need to state that the Wildlife Division of Ghana has done some work in the past that has been able to establish that there are antibodies to some Egyptian who bats, to Marburg and EVD in the past. Isolated EVD that isolated. Their evidence is saying that they actually isolated Nipah virus, but not EVD or Marburg. So the incident history is we don't have record of EVD or Marburg in the country. So we are continuing to keep surveillance on our system. We're trying to make sure that we do contact tracing on the basis of all the contacts that we have in the country. We have gotten the volunteers to be on board to do contact community case search to ensure that if there are any possible cases. And we continue to orient the medical clinicians to be able to manage the cases. We're trying to make sure that we have enough PPEs so that they can manage the cases. But so far, as of now, there are no cases. We had our EOS meeting yesterday, and they plan to continue surveillance on our system. So I would say that for now, Ghana, we are on high alert for zoonotic conditions in the country, monkeypox and Marburg. We are waiting the results of the samples that we sent to Institut Pasteur to be sure whether there's a final confirmation of it. So that's the initial confirmation from Ghana. Thank you very much.
Thank you very much, Dr. Bikwe, for this sharing of experience from Ghana. And now that we've heard from all our panelists, it's your turn, journalists, to ask questions. To do this, please use the question and answer function on the Zoom application. And please remember that you will need to provide your name and the news organizations that you're representing to have your question asked. I'd also like to announce that we have additional experts at hand. We have Dr. Charles Cote, epidemiologist, Dr. Ope, epidemiology pillar lead for the regional COVID-19 response. We have Dr. Pamela Mitula, routine epidemiology and new vaccine officer, Dr. Thieble Traoré, and Dr. Solomon Woldesek Sadiq, emergency response officer, who will also support the question and answer. Let's begin with Paul from the Lancet, who will be giving a live question.
Yes.
Over to you, Paul.
Yes, thank you very much. Today, I'm representing the Scientific American. So my first question goes to Dr. Moeti. Regarding how monkeypox response is going in Africa, what additional support do you think the organization could have provided African countries if an emergency had been declared by WHO? And for Dr. Franklin, I would like to know the reason why, even though Ghana has testing capacity for COVID, why the country still needs to send samples to Senegal, considering we expected the capabilities acquired during COVID would have enabled countries to be better prepared to respond to this. And what needs to happen so that Ghana will be able to locally conduct tests and not other countries continue to rely on Senegal. And if I can chip in a third question for Dr. Karim, looking at the landscape of zoonotic preparedness in Africa, what do you think needs to happen to quickly accelerate response such that African countries do not need European countries to confirm cases before action can be directed towards these diseases that are already endemic on the continent? Thank you very much.
Thank you, Paul. Over to you, Dr. Moeti, for the first question.
Okay, thank you very much. I think, first of all, just to say that WHO has been providing support to African member states ever since the situation arose. And indeed, we do provide support to all the outbreaks that occur around the region. So as we have observed this quickly evolving outbreak, particularly taking place in Western countries, including some cases in African countries that have not had hitherto reported cases, we've supported the usual interventions around supporting the strengthening of surveillance so that countries can follow up on what is happening, supporting the procurement of the supplies, test kits that are needed in order to be able to track the evolution of the disease, training of experts in the countries, particularly on aspects of surveillance, and then also working in terms of prevention through our country teams in order to strengthen the awareness of the public and make people aware of the prevention measures. I think as we've also been in discussion with WHO at the global level with those companies that are producing some of the vaccines and tools, therapeutics needed for dealing with this monkeypox outbreak, to see what can be the access and availability of these tools in African countries. We've been supporting countries to ensure that they know what the vaccines supplies available are to be used for, which is the closest contacts and healthcare workers, and also supporting the raising of awareness of healthcare workers about how to protect themselves, making sure that sort of the hygiene measures are strengthened in these countries. I think, of course, if a public health event of international concern is declared, several things happen. It means it may trigger additional attention from all countries that are now going to regard themselves as being at risk, so that they primarily look at how to assess their own risk, prepare themselves, even if they're countries that may not be close to where the outbreak is occurring, and possibly then trigger the availability and the allocation of additional resources at the global level that might be available to be provided, including to African countries. So what I'd like to say is that we have been already working with African countries. We don't wait for the declaration of a public health emergency of international concern in order to provide all the support that is possible to African countries. That declaration, of course, might then place the obligation on some of the entities that control some of the tools available to provide support. Additionally, it might trigger additional financial resources to be made available. It might trigger the expansion of some of the work to try out some of the tools that are available. And just to say that on the 21st of July, there will be a follow-up meeting of the expert group who will have a conversation with the WHO Director General to see if they maintain their stance or if there's going to be a shift in the advice that they provide to him in relation to how they've classified this outbreak. Thank you.
Thank you, Dr. Moeti. The second question was for Dr. Franklin Dikwe. Please take the floor.
Yes, thank you very much. So, Paul, I think that Ghana has reputable labs. We have Noguchi in Accra, we have KCCI in Kumasi, and even a reference lab. But I need to state that EVD or Marburg is rare, has never been reported in Ghana. And if you look at our protocol that we use in country, even yellow fever, when we get cases, we send them to Institut Pasteur for final confirmation. So if you have a rare condition and it's reported, we know that by WHO standards, the point of reference is Institut Pasteur, so that's why we sent it. But let me say that Noguchi is going ahead to do the genomic sequencing. So for us, I think we are following protocols to ensure that we are on the right track. Thank you.
Thank you very much, Dr. Franklin. And the third question was for Dr. Karim Tungala. Over to you.
Thank you, Paul. This is a very good question. I think Africa should better appropriate the One Health approach, really, to make sure that they prevent the occurrence of zoonotic diseases. And as a matter of fact, many countries already establish the One Health platform. So I encourage all countries to do so. And at the continental level, we have advantage of having already the Africa region One Health Secretariat. So we encourage all countries really to take advantage of access of this mechanism, really to do everything possible to strengthen their capacity for an early detection, for an early response. In that, you can be supported by WOHA through its training programs to strengthen the capacity of veterinary diagnostic laboratories. Because as we said, it will be always better to tackle the disease at its animal sources. So capacity building and appropriation of One Health are really the key. And as a matter of fact, we have some projects which are ongoing already in Africa. I talk about the Ebola project, which aim of strengthening surveillance capacity. We have a REDICE project also, which has the same objective to strengthen the surveillance capacity for an early detection, for an early response. Thank you.
Thank you, Dr. Tungaha, and thank you, Paul, for the questions. Now I would like to go on to Emery working with BBC, who has two questions that I will read out. The first is, to what extent is the consumption of bushmeat related to the transmission of zoonotic diseases? This is a question for you, Dr. Tungaha.
Yes, consumption of bushmeat is really, we don't advise. Whenever you have to do it, you have really to cook it really thoroughly to make sure that you can really neutralize, you can kill all the pathogens. As you know, this is one sources of the spilling over of pathogens from animals really to humans. So the consumption of bushmeat, it has to be very, very, very well, you have to cook very well the pathogen to make sure that all the pathogens which are in this bushmeat are really neutralized, are really killed. This is what I can tell you as an advice. Before even killing these animals to have the meat, you have to take all the precaution measures to make sure that you will not contaminate yourself and later on your family. Thank you.
Thank you, Dr. Tungaha. The second question from Emery, BBC, is what should be done by the population eating bushmeat to mitigate the rise of transmission? Shall we ask Dr. Moeti to answer this question?
Yes, thank you. I think my fellow panelists has to some degree already answered this question. I think first of all, in handling such meat, we need to be careful in terms of the precautions. If you have breaks on your skin, hand washing, making sure that we protect ourselves from being infected. And then as he said, it's very important to cook the meat thoroughly to make sure that any pathogens that may be there are killed and that you are able to eat the meat. I mean, we recognize that for some communities, there is no other choice but to eat bushmeat. So it's very important for people to understand all the precautions for getting infected, hand washing, careful handling, and certainly not eating dead animals. I think is also very important, but because in some cases that also does happen. And then handling the meat carefully, cooking the meat thoroughly, and ensuring that we minimize that. I do think that some of this is tradition. We may have to treat this respectfully, and hopefully if we improve people's socioeconomic status, the availability of sources of protein, the need then for people to engage in this with the current risks in the current context would be reduced. Thank you.
Thank you very much. We'd like now to go to a live question from Ashwin Barsingh with Observer Times. Ashwin?
Thank you for giving me opportunity to ask the question. My question is, how national animal disease control centers are essential in the countries and in the Africa to control monkeypox disease and other zoonotic disease research programs? What are the present action taken by WHO Africa for capacity building of these national animal disease control centers? Thank you.
Thank you very much, Ashwin. Dr. Tieble, could you please answer the question?
Yeah, okay, thank you very much. And yes, this is a great question. And in order to address zoonotic disease in Africa, as you all know, we have had several great ministerial meeting and high-level meeting with country to really to engage in the control of zoonotic diseases. And one happened in Libreville in 2012, and in Dakar as well, 2016, And we have had other regional meeting where the regional animal health center, which is based in Bamako, and different research institutions involved in the control and prevention of zoonotic disease were involved. And we developed a roadmap, and that roadmap and really outline how we need to address zoonotic disease with intersectoral, developing intersectoral collaboration, and to tackle the different technical areas which are necessary in the prevention of zoonotic disease at coordination level, field investigation, joint surveillance, risk assessment. All these are part of the technical area which we work with the national veterinary services and environment as well to address those zoonotic diseases, because the zoonotic diseases are so complex. And for that reason, as Dr. Kanuse and Dr. Moeti mentioned as well, at the regional level, we have a coordination mechanism for that. And at country level as well, there is coordination for to strengthen our collaboration to address zoonotic diseases. And you will see the different workshops we do for capacity building purpose. Those capacity building, one of them, Dr. Karim mentioned, is the bridging workshop. And it is central for One Health because we need to understand the weakness of this system, like veterinary one and human health, and even in ecological study, to combine all of them and work together to address, to prevent, if we can, the outbreak to spread. Otherwise, it will be kind of catastrophic, like what we have seen with COVID. But that could be prevented if the system was well established and we were well prepared. And we learn from it. We will move on. Thank you.
Thank you very much. Now we'd like to go to Christina Okello from RFI. She has 3 questions, but I guess the first one has already been answered. The question is regarding Marburg cases in Ghana. Is WHO worried about this outbreak? And has WHO been approached by Tanzania regarding the mysterious disease it's currently investigating and which has killed 3 people? Could I ask Dr. Solomon perhaps to begin the answer to this question?
Thank you very much. Very important question. Definitely, we have to be concerned about Marburg and other hemorrhagic infections for obvious reasons, because of the possibility of transmission and the high mortality and morbidity they can possibly cause as well. But there should be no reason to panic, as has been mentioned earlier. What we need to do is to make sure that we have a strong surveillance system. We identify as early as possible, confirm, and then take the necessary actions, including contact tracing. Currently, contact tracing is going on, and the investigation is also in progress. But we have to be worried, and we have to keep the vigilance and working closely with the government as well. Regarding the cases in Tanzania, yes, we are aware, we have been informed, and we are working closely with the country. As has been indicated, the preliminary investigations have ruled out the possibility of Ebola in Marburg, but I think there is still an ongoing investigation, and we are working closely with the government to come up with an expedited investigation and understand the root causes for the deaths as well. So we'll work closely with the government of Tanzania, Ministry of Health of Tanzania. Thank you.
Thank you, Dr. Salomon. Now we'll go to Dorcas for a live question. Dorcas from the BBC. Over to you.
All right, so I have 2 questions. One, has Africa reported any case of the Crimean Congo hemorrhagic fever or the nosebleed fever? While there are health experts who posit that whatever may be happening in Tanzania may be the CCHF, a question for Dr. Solomon: does Tanzania have the capacity to rule out Ebola and Marburg? Because like Ghana has said, it is Marburg is rare in the country. So how do they rule out something that isn't commonly reported? And lastly, I have a question for Dr. Moeti. WHO launched the emergency hub in Kenya, 9th of July. However, there has been a controversy with the Kenyatta University Vice Chancellor saying that due process was not followed in acquiring the land. And this is a hot topic in Kenya right now. Has WHO issued a statement about this, and what happens to the progress of the construction of the emergency hub?
Thank you very much, Dorcas. I'll hand over to Dr. Solomon for the first question on the outbreak.
Thank you very much. This is a very valid question. It's true that we have WHO referral centers, laboratories. So the advice we are giving to the country, to Tanzania, is to send the samples to the WHO referral centers. So that's what we are following as well. As I said, it's a preliminary investigation, and they can do the preliminary investigations, and based on that, they have found that it is negative for Ebola and Marburg, but it doesn't mean that that's the final concluding investigation. The sample has to be sent for a referral center for further investigation, and that's what is going on now. Thank you.
Thank you very much. Dr. Moeti?
Yes, thank you very much for that question about the WHO hub in Kenya and the controversy about the land. You know, as a UN entity, we in WHO approached the Kenyan government, the Ministry of Foreign Affairs, and the Ministry of Health in connection with the establishment of this hub, essentially expanding. We've had a small hub team in Kenya for several years now as part of our work on outbreaks and pandemics. But we engaged in these discussions with the government with regard to the allocation of land for the expansion and creation of several additional functions in this hub. And we understand that the land that has been allocated to WHO is owned by the government, and we have understood that it will continue to be owned by the Kenya government and people. We are aware that what we are going to be establishing there is actually going to co-locate with a couple of other partner organizations which are also working on health and particularly on outbreaks, including the Africa CDC. So we are anticipating working in partnership with these entities to really strengthen significantly the preparedness and response capacities to outbreaks, pandemics in the African region, particularly in East and Southern Africa, as far as this particular hub is concerned. So our expectation, we have of course been aware of all the discussions and the controversy that has arisen. We are hoping very much, and we expect that this will be settled between the different parties in Kenya. We continue to be in contact with the Kenyan government as to how to continue to develop this hub, because we think it'll be extremely important in helping us not only to put in place closer to the field some of the supplies that are needed, but also as a training center for outbreak response, including giving us the chance to help our experts to carry out simulations. So for us, it's a very important part of our preparedness and response support to member states in the African continent. Thank you.
Thank you very much. Now I'd like to read a question from Abdi from the New York Times. He has 3 questions. First is, can anything be said about the spread of the Omicron subvariants of BA4 and BA5 in Africa, and if there are concerns now about rising hospitalizations or deaths linked to them? This is for Dr. Ope. I'll read out all the questions before I hand the floor. Second question is, what can be said about pandemic fatigue and apathy, as well as how booster rates are faring, for Dr. Kamala? And the third is, I saw the WHO also decided to still categorize the pandemic as a global health emergency. With this in mind, how does WHO Africa feel countries in the region are doing? This is addressed to Dr. Moeti. So I'll begin with Dr. Ope. Thank you. Dr. Ope? Perhaps if Dr. Ope is not available, we can go to the question for Dr. Pamela on the pandemic fatigue.
Yeah. Thank you very much again, and that's a very good question. In most countries, the public health measures have quite reduced in terms of washing of hands, putting on masks, and sometimes even in crowded places, you might find people who should be cautious and putting on masks and maybe not putting on the mask. On this apathy, what we would say is that countries should really be encouraged and reminded that the pandemic is far from over, just like Dr. Moeti mentioned in our opening remarks. They need to be vigilant and continue to use all the measures of public health, as well as the vaccines that are readily available in all countries, and we are still experiencing low coverage of these vaccines. Thank you.
Thank you very much, Dr. Pamela. Dr. Moeti?
Yes, thanks very much. I mean, I think, first of all, referring to the spread of the Omicron subvariants BA4 and 5, they have spread widely in Africa. In fact, and particularly so in Southern African countries. We've seen of late, in sort of late April, early May, an uptick in cases in Southern African countries, which at the moment is actually leveling down. So so these subvariants of the Omicron, which we know is a virus that has spread extremely rapidly and widely, but also has demonstrated itself to be less pathogenic and virulent, if you like, than previous variants, has increased, if you like, the exposure in communities and increased some of the immunity in some communities. But it's also unfortunately led to a sense among people that, well, you know, people can get infected and you don't get seriously ill, which is currently challenging the process of vaccination, of getting people to accept to be vaccinated. I think the key thing is, okay, we can at any time continue to have, the virus is continuously changing, and we can continue to have new variants evolving. And what is needed is a level of alert and an ability to respond and tailor the response to what we see is happening in terms of increases, new waves of the disease, and severity of illness and deaths. Luckily, for various reasons, we have seen an increase in cases, but not the same degree of hospitals and health services being overwhelmed by severely ill people and the numbers of deaths. So, but I think we need to be alert to the possible emergence of another new variant and be ready then to ramp up the measures of control. I think that also speaks to the continuing categorization as a global health emergency. Certainly, the world is transitioning to living with COVID-19, managing this pandemic in ways that enable other aspects of life and economic development to resume, with some of the stricter measures being managed and being lowered while the vaccination is being increased to ensure that we do not get severe illness and get people dying, with health services being overwhelmed and other diseases being affected. I think what's very important to emphasize is that the impact of COVID-19 is not just in terms of illness and deaths from COVID, but it's been very significant in impacting on access to other services and affecting the evolution of other diseases, not only in Africa, but in other countries. So in our view, it's important to continue with the ability to adjust locally as we see what's happening in terms of cases, severe cases and deaths. And finally, just to end on the issue of vaccination then as a key tool to continue within African countries to encourage the interventions, initially the campaigns that are being carried out, and progressively the integration into regular services of vaccination, targeting particularly elderly people and people who have these conditions that are called, that make them vulnerable to severe illness, even as we support the adjustment to returning to some sort of normal life living with COVID-19 going into the future. Thank you.
Thank you very much. We did have a question from Dorcas that was not answered. The question is addressed to Dr. Solomon. Dorcas, would you like to take the floor and ask the question live?
Yes, please. So I was asking about the CCHF, that is the Crimean Congo hemorrhagic fever, or the nosebleed fever. Well, from research, it is endemic in Africa, and there are health experts in Tanzania who are saying what is being experienced in the southern region could be this zoonotic disease. So is this also a consideration as you continue to investigate?
Dr. Solomon?
Thank you very much. Yes, definitely. All hemorrhagic fevers, including Crimean Congo, is part of the differential diagnosis. As you know, Crimean Congo has been reported even before from other countries in our in our region, like Uganda and South Sudan. So all hemorrhagic fevers are part of the differential diagnosis and part of the investigation. Thank you.
Thank you very much, Dr. Solomon. I hope this answers your question, Dorcas. Now we'd like to go on to Ari with NPR Radio. What mental health challenges does monkeypox pose in endemic countries in Africa? How common are these challenges? Why do they arise? And how might they be avoided? In part, does it have to do with stigma or prejudice against those who are gay or other stigmas? We may ask for Dr. Solomon first to respond.
Thank you very much again. I think this is a very important question. As we all know, there is this likely link of viral infection, including monkeypox, to mental conditions because of the impact the viruses have on the neurons in our brain. On the other hand, in many countries where we have where monkeypox is endemic, we know that mental health conditions are also stigmatized. So, as you know, if someone with the disease is confronted with discrimination on multiple fronts, the chances of developing mental health condition is much higher. Therefore, it's important for all patients who are currently sick with monkeypox, as well as those who have recovered, to receive psychosocial support, screening for the more severe mental conditions, and referral if necessary, if treatment is required at higher level. Unfortunately, there is limited data about the psychiatric effect of the monkeypox virus, but there are some studies who do indicate that the virus have direct effect on the neurological system. So, as I have mentioned earlier, there is a need to screen and there is a need to provide psychosocial support. So I think it should be noted as well that mental health is a function of multiple factors. It has got genetic, environmental, social, and infectious factors. And the role of stigma and fear cannot also be underestimated. So WHO considers mental health issues seriously, and the clinical guidelines that has been developed and shared with countries have a section on how to address the psychosocial issues or the mental health issues as well. I think this is what we can say at this stage, but as we get more information, we can possibly be able to provide more insight into this in the future. Thank you.
Thank you very much, Dr. Solomon. Dr. Moeti, would you like to add anything on the stigma towards monkeypox?
Yes, I mean, I think just in general, referring to mental health, this is an area that needs a great deal more attention overall in the African region, as it does globally. It's one of the areas that are relatively neglected in countries all over the world, whether low-income countries as we have in our region and in other countries as well, and it's linked to communicable diseases and other conditions really needs to be explored and the opportunity taken to address it. Of course, the stigma, there are several aspects of stigma. We've seen with other communicable diseases as well that stigma becomes an issue that's part of what needs to be addressed so that we get the cooperation of families that are affected and communities that are affected. So some of the ways in which the language that we use, the way in which we refer to affected individuals or families really needs to be carefully couched so that we don't exacerbate the stigma. I know that there's been some discussion even about the name monkeypox and its association, and I think we are aware that in some of the controversial interactions between people of different backgrounds, there is a tendency to identify people of African origin with monkeys. We've seen that happening very much even around football, racism in football. So there's some reflection as to this. And then I don't believe that prior to this outbreak that's currently happening, particularly affecting men who have sex with men, mainly in Western countries, in the African context, there has been a concern about men who have sex with men. That hasn't arisen before. But we know, of course, from experience dealing with HIV in the past and the situation of men who have sex with men in African countries in relation to their vulnerability to HIV, that stigma has been a very big issue. So I think we need to factor in all of this and be very mindful in our own articulation, the language that we use, the attitudes that we adopt as international organizations, health experts working with communities and working with policymakers, that we emphasize and make sure that how we talk about monkeypox does not exacerbate the stigma, because what we want is for people to cooperate and for communities to feel comfortable to acknowledge this is a problem when there are cases and to work with us to put an end to outbreaks.
Thank you very much. We do have another question for you, Dr. Moeti. This is from James with Reuters. And the question is on the malaria vaccine. After decades of work, the World Health Organization endorsed the first ever malaria vaccine last year. What is WHO's comment about the supply constraints? Over to you, Dr. Moeti.
Yes. Thank you very much. That's a good question. I mean, of course, we were very encouraged by the results of first the trials and then the field testing of the feasibility of using this malaria vaccine in several African countries, and the results that came out in terms of the impact, particularly on mortality of children with malaria. Our hope would be that this vaccine would become available as quickly as possible, having had the opportunity to be involved in trying it out, having involved families, children in some of our countries in trying it out. So our fervent hope is that the financing will be made available, the agreements will be reached between different parties for this vaccine to be made available as soon as possible. And we would advocate for this as WHO in Africa and provide all the support that we could have to reach that objective, so that as many African children as need this vaccine as quickly as possible can have access to this tool that is going to join the arsenal of tools that we have to deal with malaria, which is a major killer of African children on the continent. That's what I'd say about it.
Thank you very much, Dr. Moeti. And may I ask Dr. Franklin Bikwe if he would like to add on the malaria vaccine? Just a few words.
Yes, thank you very much. So I think Ghana is one of the countries that actually piloted the malaria vaccine. And we actually had very impressive results. So we're actually waiting for the resources so that it can be deployed nationwide. Thank you very much.
Thank you very much. We're coming to an end to this virtual press conference. We had very interesting discussions. I hope you appreciated the exchanges. Now I'd like to turn to our panelists to hear a few final messages. I'll begin with Dr. Moeti for final words.
Thank you very much. No, first I'd like to thank very much my fellow panelists. Thank you so much for having made the time to join us, share your knowledge, your experience with us. And just to say how very much we appreciate the partnership on One Health with the OIE and our other colleagues, and that it's really a vital part of our collective work to deal with zoonotic diseases, which we anticipate will become more and more frequent as the changes that we mentioned at the beginning continue to occur on the continent. So we need to ensure that we build on the platforms that were mentioned, that we have worked to help our countries establish, and we build on this collaboration between the different sectors, because it's the only way that we're going to contain these diseases on the African continent. And what I'd like also to thank our colleagues, the journalists, for having joined us today. And as usual, I thank you for the work that you are doing for spreading information to our communities, to our policymakers on these very important diseases. This work needs additional allocation of resources, both at the national level and internationally, so that we accelerate the results that we are seeing. And I'd like to end, as usual, on the COVID-19 vaccination, which is something that's going to help us to transition out of the pandemic in the way that we're working in Africa to encourage everybody to get vaccinated, particularly if you are like me, elderly, if you are somebody who has some of these conditions, if you are a healthcare worker, come and get vaccinated, encourage the family to get vaccinated. We've seen some very encouraging progress in the last few months in African countries, and we're going to work very hard with our partners to continue that momentum to vaccinate our populations. So thank you all very much.
Thank you. Dr. Karim Tokara, one last word.
Thank you very much. First of all, I would like to most sincerely thank Dr. Moeti and all my co-panelists for the opportunity given to the World Organization for Animal Health to engage on this important topic. Zoonosis is, as we all understood, is really a very, very serious concern for our continent. And the key word is really collaboration, multi-sectoral collaboration. And I will say that as far as OI is concerned, we are engaged to do everything possible to strengthen our veterinary services so that we will do really efficient surveillance to early detect the diseases, so it will not come out from animal to infect humans. So once again, we have to use the opportunity of having the mechanism, Africa region, One Health Secretariat, really to build on that and have the same entity in all countries, so that the multi-sectoral collaboration will come effective within the entire region. Once again, thank you for the opportunity. And thank you once again. Thank you.
Thank you very much, Dr. Tuga. And the third panelist, Dr. Franklin Asidu Bikwe. One last word, please.
Yeah, thank you very much. And I'm grateful for the opportunity. Let me say that this occurrence of these diseases in the country raised concern of heightened awareness on unusual events. For us as a country, Ghana, what we intend doing is use the opportunity to do a very elaborate risk assessment of all reservoirs and their distribution in the country. For the Malbec, what we plan to do is to contain the outbreak at source so that it doesn't spill over. And we also want to keep a close eye on the monkeypox situation. Thank you very much.
Thank you very much. Thank you to everyone who participated, and see you at the next press conference. Thank you.
Thank you. Bye.